respected audience. Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 31st lecture on systemic pathology. Today, day 1 of diseases of cardiovascular system. Today, day 1 of diseases of cardiovascular system. Dear audience, today's topic is atherosclerosis. Before going to discuss about atherosclerosis, we have to recapitulate arteriosclerosis first. What we mean by arteriosclerosis? Arteriosclerosis means hardening of arterial wall. It means hardening of arterial wall. Thickening and loss of elasticity of arterial wall is known as atherosclerosis. Arteriosclerosis is a group of diseases characterized by thickening and loss of elasticity of artery is known as arteriosclerosis. Again, arteriosclerosis means hardening of arterial wall. If this is the arterial wall, tunica intima, tunica media and tunica adventitia, there are 3 layers of the artery. If the arterial wall become hard, this hardening of arterial wall means arteriosclerosis. Arteriosclerosis is a group of disorder characterized by thickening of the wall with loss of elasticity. If there is thickening of arterial wall and if there is loss of elasticity of the arterial wall, it is known as arteriosclerosis. Dear audience, now come to types of arteriosclerosis. Arteriosclerosis 3 types. One is atherosclerosis. In atherosclerosis, there is formation of atheroma in the intima of the arterial wall. Formation of atheroma in intima of arterial wall. Monkeberg medial calcific sclerosis. Monkeberg medial calcific sclerosis. In this type of arteriosclerosis, there is ring-like calcification in the medium-sized arteries. Ring-like calcification in tunica media of medium-sized arteries. Dear audience, suppose this is the cross section of the artery in case of Monckeberg medial calcific sclerosis, there is ring-like calcification in the tunica media of the medium-sized artery. This is known as Monckeberg medial calcific sclerosis. Third one is arteriolosclerosis. In case of arteriolosclerosis, arterioles are affected, and within the arteriolar wall there is hyaline change or there is hyperplasia. Whatever may be the change, either hyaline change or hyperplasia, there is thickening of the arteriolar wall and loss of elasticity of the arteriolar wall with narrowing of the lumen. Again, in case of arteriolosclerosis, arterioles are affected. What happens here? Hyaline change or hyperplasia in arteriolar wall. Either hyaline change or hyperplasia in arteriolar wall, and this leads to thickening of wall of arteriole with loss of elasticity and narrowing of arteriole Again, in case of arteriolosclerosis, within the arteriolar wall there is hyaline change or hyperplasia, and that leads to thickening of wall of the arteriole with loss of elasticity and narrowing of arteriolar lumen. Dear audience, now come to atherosclerosis. What is atherosclerosis? Type of arteriosclerosis. Characterized by formation of atheroma in intima of arteries. It is a type of arteriosclerosis characterized by formation of atheroma in the intima of the arteries. Due to formation of atheroma in the intima of arteries, there is thickening and loss of elasticity of the arteries. Now come to what is atheroma. It is a fatty plaque formed in tunica intima of arteries. It is a fibrofatty plaque formed in the tunica intima of arteries. So atheroma is a fibrofatty plaque that is formed in the tunica intima of the arteries. Dear audience, suppose this is an artery. This is the tunica media. This is the tunica adventitia. And these are the endothelial linings. By definition, formation of fibrofatty plaque like this in the tunica intima, this fibrofatty plaque is known as atheroma. This fibrofatty plaque formed in the tunica intima of the arteries is known as atheroma. Dear audience, now come to the name of arteries where usually atheroma is formed. Arteries where atheroma is usually formed. Large and medium-sized muscular arteries like coronary artery, of heart, carotid artery supplying brain, arteries of lower extremities. So the arteries where usually atheroma is formed, large and medium-sized muscular arteries like coronary artery, carotid artery, arteries of lower extremities. Elastic arteries like aorta, like iliac arteries. Again, coronary artery, carotid artery, arteries of lower extremities, aorta, iliac arteries are the arteries where usually atheroma is formed. Dear audience, now come to risk factors of atherosclerosis. Risk factors of atherosclerosis. There are two types of risk factors. One is major risk factor, another is soft risk factor. Dear audience, the risk factors, either major risk factors or soft risk factors. Some risk factors are modifiable and some are not modifiable. Some factors are modifiable and some are not modifiable. Now come to major risk factors. Major risk factors are cigarette smoking, hypertension, diabetes mellitus, and hyperlipidemia. So major risk factors are cigarette smoking, hypertension, diabetes mellitus, and hyperlipidemia. Dear audience, now come to soft risk factors. One is age. With increasing age, incidence of atherosclerosis is increased. With increasing age, incidence of atherosclerosis is increased. Dear audience, with increasing age, the incidence of atherosclerosis is increased. Sex, usually common in male, but after menopause, male and female are affected equally. After menopause, male and female affected equally. Inadequate physical activity. Dear audience, inadequate physical activity increases the risk of atherosclerosis. Inadequate physical activity increases risk of atherosclerosis. Obesity. Dear audience, among the obese individuals, risk of atherosclerosis is more. Among the obese individuals, risk of atherosclerosis is more. High carbohydrate intake. Dear audience, high intake of carbohydrate increases the risk of atherosclerosis. Increases the risk of atherosclerosis. Hyperuricemia. Hyperuricemia increases the risk of atherosclerosis. Increases the risk of atherosclerosis. Use of oral contraceptives. Dear audience, use of oral contraceptives increases the risk of atherosclerosis. Increases the risk of atherosclerosis. Again, the soft risk factors are age. With increasing age, incidence of atherosclerosis is increased. Sex, usually common in male, but after menopause, male and female affected equally. Inadequate physical activity increases risk of atherosclerosis. Obesity increases risk of atherosclerosis. High carbohydrate intake increases risk of atherosclerosis. Hyperuricemia and use of oral contraceptives increases risk of atherosclerosis. Dear audience, we are talking about atherosclerosis. It is a type of arteriosclerosis where there is formation of atheroma in the tunica intima of the arteries. And you know atheroma is a fibrofatty plaque, and you also know in atherosclerosis there is thickening of the wall and loss of elasticity of the arteries. Now come to pathogenesis of atheroma formation, that is how an atheroma is formed in the artery. Pathogenesis of formation of atheroma, that is how an atheroma is formed. There are two hypotheses for formation of atheroma. two hypotheses for formation of atheroma. One is imbibition hypothesis of Burko, imbibition hypothesis of scientist Burko. Another is reaction to injury hypothesis. Reaction to injury hypothesis. Dear audience, two hypotheses for formation of atheroma. One is imbibition hypothesis of Burko, reaction to injury hypothesis. First come to imbibition hypothesis of Burko. This imbibition hypothesis states that increased filtration of lipid, protein and other components of blood in tunica intima of artery is associated with atheroma formation. Again, imbibition hypothesis states that increased filtration of lipid, protein and other components of blood is associated with formation of atheroma in tunica intima of arteries. Dear audience, suppose this is the blood vessel, this is tunica media, this is tunica adventitia, lining endothelium. Increased filtration of lipid and protein of blood in tunica intima of artery. Suppose this is the protein and lipid due to increased filtration in the tunica intima. This is the lipid and protein in tunica intima from the blood. Due to increased filtration of lipid and protein, there is low-grade inflammation in the arterial wall. Low-grade inflammation in arterial wall. Dear audience, you know reaction of vascularized living tissue to local injurious agent is known as inflammation. So due to this lipid and protein in the intima, there is inflammation in the arterial wall, and this is low-grade inflammation. Low-grade inflammation at this point. Due to low-grade inflammation, there is proliferation of cells. Due to low-grade inflammation at this point, proliferation of cells. Proliferation of cells like smooth muscle of tunica media. So due to low grade inflammation in arterial wall, there is proliferation of smooth muscles of the tunica media. So there is proliferation of the smooth muscles in the tunica media. Then migration of smooth muscles. After proliferation of the smooth muscle cell migrates. Migration of smooth muscles in tunica intima. This smooth muscle cells synthesize extracellular matrix. This migrated smooth muscle synthesize extracellular matrix composed of collagen, elastic fiber, proteoglycans, and this extracellular matrix along with lipid forms atheroma. There is again imbibition hypothesis of Burko states increased infiltration of lipid and protein from blood in intima. Due to this increased filtration of lipid and protein, there is low grade inflammation in arterial wall. Due to low grade inflammation in arterial wall, there is proliferation of cells like smooth muscle tunica media. This proliferated smooth muscle cell migrates in the tunica intima, and these cells synthesize extracellular matrix like collagen, elastic fiber, and proteoglycans. This extracellular matrix with lipid forms atheroma. This is the imbibition hypothesis of Burko. Dear audience, now come to reaction to injury hypothesis. This hypothesis states that some sort of injury in the intima is associated with formation of atheroma. This hypothesis states that some sort of injury either by hypertension or by hyperlipidemia or by cigarette smoke or in diabetes mellitus, there is some sort of injury in the tunica intima. Is associated with atheroma formation. Again, this hypothesis states that some sort of injury either in hypertension or in diabetes mellitus or due to cigarette smoke or due to hyperlipidemia is associated with formation of atheroma in tunica intima. Dear audience, suppose this is the blood vessel, endothelial lining, this is the tunica media, this is tunica adventitia. Injury in intima, due to injury in intima, suppose this is the injury, entry of lipid in subintima. This is the lipid in subintima. Due to injury in intima at the focal injured part, adherence of platelet and monocyte. At focal injured area, adherence of platelet and monocyte. So these are the platelet and this is the monocyte that adheres at the site of focal injury. Platelet and monocyte secretes growth factor. So this monocyte and platelet secretes growth factor, and this growth factor is associated with proliferation of the smooth muscles of the tunica media. Growth factor is associated with proliferation of smooth muscles of tunica media. So the red one is the smooth muscle, there is proliferation of the smooth muscles. As there is proliferation of the smooth muscle fibers, smooth muscle is migrated in tunica intima. Migration of smooth muscle fiber in tunica intima, where there is lipid. Where there is lipid, smooth muscle fiber is migrated there. Smooth muscle fibers synthesize extracellular matrix and is composed of collagen, elastic fiber and proteoglycans. Smooth muscle fibers synthesize extracellular matrix composed of collagen, elastic fiber and proteoglycans. Dear audience, the monocyte that adhere at the focal injured area is converted to macrophage. Monocyte is converted to macrophage, and this macrophage engulfs the lipid that is present in the subintima. Engulfs lipid in subintima and is converted to lipid laden macrophage. Again, the monocyte that adhere at the focal injured area is converted to macrophage, and this macrophage engulfs the lipid and is converted to lipid laden macrophage. It is also known as foamy macrophage. It is known as foamy macrophage. Dear audience, this foamy macrophage, this lipid, smooth muscles, collagen, elastic fiber and proteoglycans. Again, this foamy macrophage, smooth muscles, collagen, elastic fiber, proteoglycans and lipid makes the atheroma. Formation of fibrofatty plaque, that is atheroma. Formation of fibrofatty plaque, that is formation of atheroma by lipid extracellular matrix, collagen, elastic fiber and proteoglycans, smooth muscles, and lipid-laden macrophage. Again, formation of atheroma by lipid, extracellular matrix, smooth muscle, lipid-laden macrophage, and this is the atheroma. It is fibrofatty plaque in the intima of the arteries. Dear audience, again, reaction to injury hypothesis states that some sorts of injury in the intima, either by cigarette smoke or in diabetes mellitus or in hypertension or in hyperlipidemia. At the focal site of injury, there is entry of lipid in the subintima and adherence of the platelet and monocyte. The platelet and monocyte synthesize growth factor, and this growth factor causes proliferation of the smooth muscles of the tunica media, and there is migration of the smooth muscle fibers in the tunica intima. This migrated smooth muscle fibers synthesize extracellular matrix composed of collagen, elastic fiber and proteoglycans. The lipid that enters into the subintima through the injured part is engulfed by the macrophage that comes from the adherent monocyte. This macrophage engulfing the lipid is converted to lipid-laden macrophage, that is foamy-histiocytes. The lipid extracellular matrix composed of collagen, elastic fiber and proteoglycans, smooth muscles, lipid-laden macrophage all makes the fibrofatty plaque in the tunica intima of the artery, and this is atheroma. Dear audience, this is all about the pathogenesis of atheroma formation. Dear audience, this is fibrofatty plaque, endothelial lining, blood is running like this. This is atheroma. Dear audience, now come to morphology of atheroma. Gross examination reveals fibrofatty plaque protruding in the lumen of the artery. Reveals fibrofatty plaque protruding in lumen of artery. Dear audience, this is the fibrofatty plaque protruding towards the lumen of the artery. Cut section reveals deeper portion of atheroma is soft and yellowish. Luminal aspect of atheroma reveals fibrous cap. Dear audience, atheroma is fibrofatty plaque with a fibrous cap. If we cut it, we will see this is the fibrous cap like this. This is the luminal aspect, and this is the deeper part composed of soft and yellowish material. This is the cut section of atheroma. Histopathology of atheroma reveals cells like lipid laden macrophage, like smooth muscles. The core of the atheroma reveals lipid laden macrophage and smooth muscles. Connective tissue, it is composed of collagen fiber, composed of elastic fiber, proteoglycans. So cells, lipid laden macrophage, smooth muscle fiber, connective tissue, collagen fiber, elastic fiber, proteoglycans. There is intracellular and extracellular lipid. Dear audience, intracellular lipid is found in the lipid laden macrophage, and outside it there is extracellular lipid. So these are the histopathological findings of atheroma. Dear audience, we are talking about atherosclerosis. It is one of the type of arteriosclerosis where there is formation of atheroma in the tunica intima. Atheroma is a fibrofatty plaque with fibrous cap formed in intima of the vessels like coronary artery, carotid artery, iliac artery, aorta, arteries of the extremities. There are soft risk factors and major risk factors. There are two hypotheses of formation of atheroma. One is imbibition hypothesis of Barco, another is reaction to injury hypothesis. Whatever may be the hypothesis, there is formation of fibrofatty plaque in the tunica intima, and it is composed of lipid, smooth muscle, collagen fiber, elastic fiber, proteoglycans, and extracellular and intracellular lipids. And it is formed in the tunica intima. Due to formation of it, there is narrowing of the lumen of the artery. Also there is thickening of the arterial wall and loss of elasticity of the arterial wall, you know. If anybody suffers from atheroma, what may be the complications? Complications of atheroma. Dear audience, suppose this is the artery, blood is flowing like this, and this is the fibrofatty plaque, this is the tunica media, this is the lining endothelium, and this is the tunica adventitia, and this is the atheroma. What may be the complications? Calcification in atheroma. Dear audience, if there is calcification in the atheroma, it will be more hard, and due to hardening of the atheroma following calcification, there will be further loss of elasticity of the arterial wall. Hemorrhage within the atheroma. Dear audience, if there is hemorrhage within the atheroma, the size of the atheroma will be increased. As the size of the atheroma will be increased, there will be further narrowing of the arterial lumen. Ulceration on surface of atheroma. Dear audience, if there is ulceration in the surface of the atheroma, what will happen? At the ulcerated site, there will be formation of thrombus, and that thrombus may detach and forms embolus. So ulceration on the surface of the atheroma, formation of thrombus, and detachment of the thrombus is associated with embolus. Again, ulceration on the surface of atheroma, ulceration on surface of atheroma, formation of thrombus, and due to formation of thrombus, there is further narrowing of the arterial lumen. Further narrowing of arterial lumen. Dear audience, if there is ulceration on the surface of the atheroma, there is formation of thrombus. Due to formation of thrombus, arterial lumen become narrow, and if there is detachment of the thrombus, there is formation of embolus. Dear audience, at the site of atheroma, there is weakening of the arterial wall. Due to weakening of the arterial wall, there is formation of aneurysm. Formation of aneurysm at the site of atheroma. Dear audience, at this site of the arterial wall become weak due to formation of atheroma. Due to weakness of the arterial wall, there may be dilatation, and this abnormal dilatation is known as aneurysm. Again, if anybody suffers from atheroma, what may be the complications? Calcification in the atheroma is associated with the further hardening of the arterial wall. Hemorrhage within the atheroma is associated with the increased size of the atheroma, and there is narrowing of the arterial lumen. Ulceration on the surface of the atheroma is associated with the formation of thrombus, and if the thrombus is detached, there is formation of embolus. Ulceration on the surface of the atheroma is associated with thrombus, and due to formation of thrombus, there is further narrowing of the lumen of the artery. As there is weakening of the arterial wall at the site of atheroma, there is chance of localized dilatation of the artery, and this is known as aneurysm. So these are the different complications of atheroma. Dear audience, today up to this about the atherosclerosis briefly. Thanks all.